let me just appraise you guys of what you need to, and this is the last time I'm going to do it.
Me? Oh.
When you started here, you did not start, or were not told you have to get laptops. So you guys have to get laptops. And what's the rationale for that? So you can be doing those NCLEX questions, you can study and have different views on different things. Instead of just reading the book and then trying to do tests on a piece of paper or something like that. That's in the, maybe the 1960s, 1970s, not in this modern day. If you don't choose to go online and do those tests, those quiz, then you are preparing yourself for whatever you think you prepare yourself for. I give you the sites. I even go so far to teach you how to do the Microsoft, to do the PowerPoint, all that sort of stuff. Why? I didn't have to do that. This is not a requirement for you guys. But I know you need to do that. This is not a requirement of the course. You're supposed to get a book, read the book, and then when I give you the answers, you write it. Not sit with no laptops in front of you. And you know that because when you came here, you were given 2 big books. You're expected to sit down and read it, and then go and do it. That's old school. That don't happen in this modern college scenario. I hope you guys understand, like I said before, it's only you and you alone when you're doing the state board. That's all I can say. From on that, I say no more. All right, yesterday, we went through medication admin. Oh, before that, let me just do this attendance because there are people who have some really bad attendance now. I'll give it to him. Let me see his attendance.
Mr. West.
No, you can do what?
Oh, you get the quiz on for free.
On what?
For free.
No. You gotta get PrepU, and when you get PrepU, you have to know the book that you're using, because they're gonna ask you that question. The book that you're using. And unfortunately, the book that's here that you have, you can, when you go to purchase it, you can tell them. All right?
So it's like a study guide?
Go ahead. For those L10s who've been in RN school, they know about it. And you have Kaplan and PrepU on a weekly basis, not at the end of the course. And that's why I try to get you guys involved when I say go do the 3 NCLEX questions every week. But some people got their own ways of doing it, so I'm not even going there anymore. You're going to get quiz, I'm going to give you some quiz. You do what you think is right. I think it's a waste of time. That's me. I'm speaking now. You guys come and get a piece of paper and send a piece of paper and do quiz in here is a waste of time. And I'm going to say more. All you want to go ahead. You're wasting time. Please go ahead.
This sounds like perfume, but
This point, right?
no, I've bought this one, and I have perfume from my school. You got it? Oh,
That was it?
that's, we both also.
No. You were going to tell us something.
Yeah, so we both, you choose whatever book you want. Like, actually, the one I'm working on right now is, NCLEX. And then it says comprehensive reading for NCLEX. So when you go on the book, they're gonna tell you all that if you're gonna have to do is either pharmacology, if you're doing, try to stay on a topic like you get pharmaco, you get concept nursing. You can choose 3, and then you're gonna get a question about those 3 all the time. And then the question is like 250, 1,000. It's up to you. You don't have to do too many questions. Because you can go back to it over and over and over and over, you know, that's it over again.
Except if you're in college.
Yeah.
In college, you have to complete certain things.
Okay,
Alright.
100 questions.
Our daughter disagreed, some will set this now that you can do the test and then you go to when at the end you come do the test. If you fail them in the college, you're out. That's all I can say. If you do tests and all those tests you guys been failing, you will be out of this classroom. I'm telling you the right thing. I'm trying to teach you guys the right way. And what bothers me so much is that I put it in see, I don't throw everything at you one time. I give you piece by piece. Because I realize some of you come from old school. And you're accustomed to papers and writing. But everything that like what she's talking about there is dealing with, you have to get onto the computers. You have to do quiz every week. You have to, and if you don't pass it, you go out. And that's a program I've been teaching. And when I come, I try to introduce it in here because I realize you guys are supposed to, they're getting more time. They're getting clinicals every week and classroom, whole day. 4 days in all they're working. You guys come in 1 day. And they're going for 18 months. You go for 12. I don't know how better to put those into you guys. I don't know any more than I've done. If family want quizzes, he gets the quiz. All right.
So the quiz is gonna be like on.
You got quizzes. Whatever we're gonna
I'm
be
just
doing in
asking
classroom,
a
I'm just
question.
saying. Just like what Sandy said, that you get quiz, I'm gonna give you quizzes twice a month.
You never give her a chance to talk, Mr. West.
Let me finish.
She's trying to tell you stuff. You never giving her a chance to talk.
What do you wanna do?
I don't wanna do anything anymore.
Come on, man.
I'm gonna do
Too
basically
emotional,
what
man,
Stanley
too
wants.
emotional.
Stanley wants you guys to have quizzes, and he said 4 or 2, I'm gonna give you 2.
But Stanley's not our
That's it.
teacher.
I'm done. Because I've set up my program, how I think people are supposed to learn. Some of you don't have the education of some of us in the class. Some of you are slow at learning. Some of you are fast at learning. Do I drop the people who are slow at learning?
No.
Should I leave them behind?
No.
Oh my God, this is really sick now.
Yeah, that's why I don't want people complaining.
That's not what you said,
Yeah, what he said is true.
Yes.
So,
We can be too selfish.
well, it is what it is.
This is not fair.
All right, so we have the right patient, the right drug, the right. Come on, please move on.
The right route.
We talk about the 5, but we know that it's not just 5. Now we talk about as much as what?
10.
10 that you utilize.
Right
And please remember what we spoke about with each one of those rights. We took a long time going through the rights yesterday. We didn't even touch the card. Because you need to know, before you administer medication, what are the legalities, what are the policies, what are the procedures, things that you need to know even before you touch the card. And we kind of discussed that yesterday. Please bear in mind that when you're given medication, if you make a mistake, you can harm your patients. Please bear in mind, at your level that you're going to be going to, which is as a registered nurse, you will have the responsibility of looking at what the LPNs are doing. And they will look to you for guidance. So if they're going to look to you for guidance, they will definitely, will definitely need to know all the things that we talked about yesterday. Everything that we spoke about yesterday, you need to know.
You was there.
I'll show you.
Now, yesterday we talked about, and please pull up back the images you had on the MAR. Please pull up the MAR.
One second, let me find it for you.
Hmm? Oh, in the car. Sorry. Where did you get that?
Hmm?
That's the thing.
Mm-hmm. No, that's not Google.
Huh?
That's
Now
not
basically
Google.
when you look at the MAR, everyone got it? Who
Yes.
hasn't got it as yet? Just raise your hand.
It's on
Who
your,
did not get it as yet?
on your WhatsApp. It's on your
All right,
WhatsApp.
just go online and you look for medication administration record. Pull up a copy so you can look at the copy as you go through it. Medication administration record.
No.
Medication administration record was referred to as the MAR. And you're going to hear persons utilize that term. You know, go get me the MAR or something like that if it's still using paper. If not,
That's it.
then of course you're in the computer.
Oh, I see it this morning. I didn't know what it was.
You have the MAR. There's the medication administration record. If you see TAR, it is a
Treatments.
treatment
Administration
administration
record.
record, and this here is used for
Wound care.
wounds,
Wound.
rashes,
Rashes.
etc. Anything pertaining to the skin. Now we're focusing on number one, which is the medication administration record.
Smoke.
Now last time, not last week, before, I specifically said I didn't want sort people to sit next to each other. And when these persons will move to where I said we should not be seen, we're going to start classes. Okay? We all have something also called a log, a log that you use for medications that have narcotic properties, which is your controlled substances. So you have a specific log for that. And that log is utilized when?
When you first come to the unit.
Handing and taking over of narcotics is done at the start of the and
Shift.
the end of the
Shift.
and you require how many persons?
Two.
two persons, because you're required to have two
Signature.
signatures. And normally on your MAR, you wait until you have administered medication before you
Sign for it.
But when you're taking from the log, once you take the medication, you have to sign for it immediately. Not wait until you finish administering the medication. If the medication falls onto the ground, you have to waste it. And if you're going to waste the medication, you also require
Just sign.
a second person
Just sign.
to ensure that the medication is not being diverted.
Mm-hmm.
Quite a few nurses have 2 and 3 different jobs. And when the shift overs at, let's say, at 7 in the morning, they want to get out of there. But the next nurse who's supposed to be coming on may be late. So some nurses will leave the keys. I hand the keys to the supervisor. That supervisor should not take the keys unless they have count that narcotic with you and signed. So most of you are going to be RNs, and more than likely, if you're going to work in these facilities, especially in a nursing home, you might work as a supervisor or the RN manager. Do not take keys from anybody for narcotics, and you have not checked the narcotics. Because you can have narcotics that might have been diverted. And you go and take the keys, the next thing you know, you have to answer some questions. You don't want that to happen.
It's the same thing too if you work in the ER?
If you work in the what?
And the ER.
Narcotics is narcotics wherever you
No,
go.
I asked.
Yeah, the same.
Wherever you go, narcotics is narcotics. You always have
Since
to
it's the
show
bigger hospital, I think that they would just,
in the acute care and
Still
in
need 2 signature.
narcotics is narcotics. Okay? Now you have also on the cards, and I mentioned this yesterday, the card have a specific lock box on the medication card. You do not put the medication in the cart without putting it inside a lock box. You must have 2 locks. When you lock the cart, there's only one. Each medication cart has a separate box for.
Narcotics.
Don't take the narcotics and put it in the, the very first red shelf. Some people put it in there for easy access. That's a no-no. That's a problem. Do not do that. Also, I mentioned yesterday that you only will take the medications that you're going to administer for that specific time frame. If you're doing the 9 o'clock medications, you take the narcotics only, it's going to begin for 9 o'clock. The remainder of narcotics should be in the
Box.
box.
In the office.
The medication room. Please remember this about narcotics.
So what about if you're gonna give this to the patient and it fails? What happens?
You waste it.
That's what I just mentioned just now. You have to, it's called wasted medication. And once you waste the medication, you have to have the second
Co-sign.
nurse.
To sign it.
So, not just to sign, the
Count
nurse
it.
needs to see.
That you.
And that's the problem that we have in the industry. A nurse will say, you know, I waste something, this medication fall, come sign for me. Maybe the medication didn't fall anywhere.
Mm-hmm.
Maybe you have that medication in our pocket or in his pocket. So you need to see, like, show me the medication. And show me that you throw it down the toilet. Because that's how we destroy the narcotics that were not used, we have to destroy them. And when we destroy them, we have to call the Department of Health. And then the Department of Health, we gotta tell them the names of the patients, the number of the medications, everything about it. And then they either will send somebody to collect it, or they're sent to see that you have destroyed it. There's two options the Department of Health gives you with narcotics. If the facility have the narcotics, the patient died, you don't just say you're wasting it. You have to indicate the name of the patient, the number of the narcotic, not the number of pills, but their drug number from the pharmacy that they dispense with. You have to make out a list, and then that list goes to the Department of Health, and then you will tell them whether you want them to come and collect it, and they'll send somebody to come and collect the narcotics. Or you will tell them we will destroy it. And to destroy it, you have to have two of you doing it, and you have to put it into hot water, melt it, and then flush it down the toilet. It's not something that's just like that.
I thought they said they don't want you to waste them no more. You have to give it back to the pharmacy.
You gotta report everything to the Department of Health. The numbers, gotta go to the Department of Health.
Yeah, they said something about the water, they don't waste them no more, they don't want you to flush them no more. You gotta give it back, like give them back to the pharmacy.
When did you hear that?
Not too long ago, because where I work, that's what we used to do. With the nurse, we used to flush them. But now they want, the pharmacy want them back, whatever you're not using, they want you to put it in an envelope and then give it back to them.
They want to put it in where?
Envelope, and then
Envelope.
after you count, give it back to them.
Guys, the narcotics is reported to the Department of Health, right? And it goes back through the Department of Health for diversional purposes. If there's any other changes to that, I will let you know. But for right now, that's what it is.
I was under the assumption that when you going to discard or waste a narcotic, you need to get a signature from the supervisor, not a peer like another
That's
LPN.
facility policy. Once it's a
Sometimes
registered nurse
it depends.
or another LPN, once it's a licensed staff, licensed nurse,
You can.
that's
you can
all.
together.
You don't
Okay.
have to be no supervisor.
Depends on the policy.
Alright?
Okay.
The only time, if it's a supervisor, is if that facility or the organization you're working with, they
Their
made a
policy.
policy to say
Okay.
that's what they're gonna do. Remember, facilities run by policies, okay? Okay, so, any questions related to narcotics?
What about if you do manual quotation and the patient claims that they don't get it from the bedroom or you didn't give the patient a new sample?
Right, we did what we call documentation, right?
Yep,
Once you document,
it's done.
it's done. Some patients who are,
Drug addict.
addicted to the drugs, they will say they didn't get it. Then, of course, there are situations where nurses have been diverting medication. That is, they've been taking the medications themselves and say that they give it to the patient when they did not give it to the patient. And when that happens, now that's a big problem. If you're the person who's in charge, you're the nurse manager in the unit, then you have to report to the director of nursing. Director of nursing now have to report it to the AG office. Because that's a serious, that's like, if you deal with drugs in the street and something goes wrong, where they're caught with it or something like that, and same thing. The cops will come. Not the cops that you see on the streets here. The cops will come from the AG office. They come their badge and their gun just like regular police. And they'll put their handcuffs on you. And they'll walk you out. And they love to do that. I'm telling you, I've seen it. I've seen them put handcuffs on a guy and walk him out the building. So you don't want to get into those situations. Please check your medications. Please ensure that you always see what is being destroyed. or discard it. Don't let somebody tell you, oh, don't worry about it, I got it, and that sort of nonsense. Don't pay your license. Okay. Before I move on, any questions related to narcotics, the destruction, the takeover? And yesterday we talked about destruction of fentanyl. And fentanyl we know is transdermal. And fentanyl you also need how many persons?
2.
2.
To take it off.
Hold up, hold up.
One person can put it on, but need two persons to
Take
take
it
it
off.
off. Why?
To verify that it's being disposed properly.
Verification that it is being disposed. That's why you need two persons. It's just like when you administer the pure medication and fall to the floor, you gotta see that the medication is being picked up and is being disposed of. Now the medication is being picked up and somebody is gonna say, we dispose of it, and you sign that it's happening like that. Don't let that happen, okay? What else? Anything else you guys need to know about the narcotics? All right. We talked also about storage. We spoke about use of the refrigerator. And we specifically say that the refrigerator should be between what temperatures? Between 36 and 46. And especially when you're going to be using insulin, do not shake the insulin. You roll it in your palms of your hand. Okay? We talked yesterday about giving, specifically spoke about the sub-Q. Because given the sub-Q, you give it at 45-degree angle, right? But
Yes.
the needles, the gauge of needles, you give it right. Straight perpendicular, because the needles are small, it goes directly to the subcutaneous system. But for state boards, you must remember sub-Q is at 45 degrees. Some people indicated that
Oui.
you can they're based on the size of the person. When you use the word overweight persons, that you can do and go straight down because they have a lot of subcutaneous tissue. I didn't say fat. I'm very happy with that.
Go 90
They have a lot
degrees.
of subcutaneous tissue, so it will go straight into subcutaneous tissue.
Overweight.
Now, when you give the patients the PRNs, we said one of the things you gotta remember is that you always have to write a note.
Right.
A lot of times nurses don't write notes. Just give the patient complain of a headache, and getting tired of Q for only PRN. They just give it and that's it. Headaches is a serious thing. Headaches is a warning. Pain is a warning. When you get pain, it's a warning of something. Especially the pain that's not related to exercise. So when you're getting headaches, that's sometimes that something is going wrong. A headache could be due, as people say, to stress. You know the stress kills, right? But people say, I got a migraine. That's serious too. Because these can lead on to something that's bigger and worse. Headaches, as I said before, are things that you should not just ignore. and say I got a headache and then, you know, headaches is a serious condition. There's something called CB in evolution, and headaches is a sign of it. TIAs, which is like mini stroke, also preceded by headaches. So when persons have headaches, you need to do more of an investigation, history taking. So when you have your PRN, some people don't confirm headache. They don't give the patient any, write any notes. Just give the patient 2 pills and say that's it. But if they continue, and the headache happen again later on, and keep happening, you're giving them the pills. Now this definitely have to go to where? Pain management. Because the headache is not subsiding, it continues. You give the pills now, the headache goes down, but then comes back tomorrow. That's a concern. Consistent migraine is a concern. All right? So you just don't write, you don't just give a PR medication. You need to what? What's one of the right tests you guys were talking about? Follow
Right
up,
documentation.
Right? Follow up. If you don't follow up with the patient, things can go wrong. You need to follow up with the patient. See that the medication, how effective it is. And we know that this thing they call about breakthrough. Right? Breakthrough what? Pain. So for patients to keep getting pain all the time, and the medication is not working, and you're just not making notes, that's a serious problem. We don't know if the patient is having any breakthrough pain or not. We don't know if this can lead to a bigger, worse problem. So you need to write your PRN notes. When a patient refuses, and we went through some scenarios yesterday, but you need to document that the patient refused. And people just write, patient refused. Don't just write this patient refused. Write the circumstances, situation that caused the patient to refuse. Right? And you kind of quote the patient. If the patient said, I have enough of this damn pills, I don't want it anymore, you write exactly that.
What she said.
Don't just write patient refused. Write what the patient did or said at that time to indicate why they're refusing the medication. This will now allow the doctor to know it's not a problem with the medication, it's a problem with the patient. And the patient now will go under care plan as being non-compliant. Because now you have to update your care plan for pain. And under pain, you'll be what? Non-compliant behavior. Patient is refusing to accept the medication. So the therapeutic benefits, and yesterday we spoke about therapeutics, right? So the therapeutic benefits cannot be achieved because the patient is refusing. And it's not that the medication was of a low dosage, that you had to increase it. So those PRN notes is very important. And you need to have follow through. Now for some of you who are not nurses and who got CNA, what are some of the reasons you've heard patients say they don't want to eat food?
They don't like what they have or they don't want to.
Yeah, well, no. We can avoid the culture, but what they
Every
actually
day.
say when you get the food.
Tired of it.
I'm tired of seeing the same thing over and over.
I'm tired of eating the same thing all the
Over,
time.
yeah. Over and over. That's true.
Culture also puts in.
Absolutely culture, but what you want, you're not going to put cultural preference you're gonna put exactly the patient is saying.
Tired.
I don't try to give this nonsense all the time. Or, look, the eggs are not done properly. Or, right, they don't make, the eggs are not done the way they want it. Or, they may say that they expected oatmeal and oatmeal did not come, so they want nothing.
It's true.
So you take that scenario and put it now to drug administration. When you give it the drugs, exactly what they're going to be telling you. Put it in there, and now the doctor can know what to do. Because if it's a behavior problem, you want to go a little more in depth. Is this person got between a what? An 8 and a 12? Is this person bends between 8 and 12? Mean that what? They're moderately impaired for decision making? So at times they're going to be with it, and other times they're not going to be with it. So you definitely need to have who? The psychiatrist see this patient. Because remember that before a patient can sign certain documents or refuse certain things, you have to have a what?
White man.
Doctor's order.
Capacity done.
White
Capacity to make
man.
decisions.
Decision.
Right.
We discussed that yesterday.
That's right.
You gotta have a capacity. And you just can't say the patient is refusing and they're not gonna do anything about it. Alright? So the psychiatrist got to give a capacity, and it's not the primary doctor. The primary doctor is what you can usually call the patient's doctor, right? But the patient doctor have to consult with their psychiatrist when it comes to matters of their mind and making certain decisions. The doctor cannot say this patient don't have capacity. That's not within his field. The psychiatrist got to do that. Now, if you look at the basic administration record, you're going to see at the top it says what? Medication administration record. It has what? The patient's name, the date of birth, and the sex. Remember when we did the fourth, the right, which is what? Right patient, right?
Right patient.
So you want to know the name of the patient, right?
Date of
And
birth.
usually on these medication administration records, once it's in the computers, you have a what? A picture of the patient.
Of the patient, yes.
In the
So you're
record.
seeing who you're giving it to. And by the way, guys, wherever you're going to work, you got to learn how to use the software that that facility is using. Most places now are using around New York is PCC, Puncture Care. Other places you're going to find them with
Sigma care.
A lot of places are
Sigma
changing
Care.
up to Sigma Care because, changing from Sigma Care because PCC seem to be, most people say it seem to be
Point click.
better.
User-
Puncture Care,
user
which is
friendly?
PCC. Huh?
User.
Because it's more user friendly.
Right.
But before all of these, they had RHS, Reliable Health Systems. And they still have facilities that are still using Reliable Health Systems. So whatever facility you go to, you have to learn to use that software so you can get to do your job. Right? And one of the things that this software does, that the nurse, which you being the nurse manager, the nurse on the floor, the RN, you don't have to go and ask the nurse if they give a medication. You can just look at there. And when the tour, the time is passed, like the 9 o'clock medications, the time is passed and what have you, it gives off alert. Let you know which patients did not get the medications. So you don't have to go running and asking, you can see. And what do you think some of the nurses are going to tell you? They didn't sign when they did the medication. And that's crazy. You just got to click it. Is it not so, LPN?
Yes, sir.
That's correct.
Mm-hmm.
Now you now will be checking to ensure that it's being given. Because again, remember yesterday we talked about therapeutic benefits, right?
Yes.
Because when the medication goes into the blood, you need to have therapeutic blood levels. And one such medication you know of, give me an example of a patient, a drug that you get by that knows therapeutic blood level. What's that?
Valproic acid.
Dilantin.
Dilantin.
And you also said vancomycin. Because if you have too much of it, you can get what?
Bleeding.
Right, we talk about this. You can get what?
Sepsis.
Toxicity.
Mm-hmm.
And what is toxic? Poisoning of the patient.
Patient.
So you give him medication that is good for the patient,
Mm-hmm.
but if you give too much of the medication, it can what? Kill the patient.
Patient. Mm-hmm. You drop something?
All right? So that's where we talk about therapeutic blood levels.
Mm-hmm.
All right, so now you have, what also you have on it will be the facility name, and of course, number of the, what? The room number.
The room number.
Mm-hmm.
Very important.
Also, in the mall you get the diagnosis for the client too.
Yeah, but we got in there. That's
Okay.
good. So you have facility name and number.
Mm-hmm.
The room.
Why you think you need to have the number up there?
But you talking about the patient room?
The room number.
So you can know who's the patient is.
So you don't.
You don't. So you don't miss room. You can know the resident.
Have you ever, for the doctors, have you ever come across a situation where patients have been moved to another room?
Yes.
Yeah.
And have been changed in the system?
Yes.
Nope.
There you go.
Mm-hmm.
So you have to ensure that you look at that what?
The waistband. The
Wristband.
waistband.
Remember, you always gotta have that at least two means
They-
of identifying your
Mm-hmm.
patient.
To identify us.
Now they put.
Because many times they move a patient for whatever reason, and they don't change that. Not only do they not change the information in
System.
the system, they also don't let dietary notes.
No. Oh yeah.
So a lot of snafus can happen with the system. And it happens every day in facilities around America. Not every day in the same facility you're having the problem, but this is something that happens a lot. I remember yesterday we talked that patients can be sent out from, like, say, from the
Hospital.
nursing home to the hospital, or from a clinic to the hospital, and they don't have any what?
Waistband.
Right? And that there creates a big problem, huge problem. Okay? So the the MAR, gotta ensure that when you're looking at the screen, as you're looking at it right now, you know that the patient that you'll be giving is the right patient in the right room.
Mm-hmm.
All right, so you got a different type of right now. The right patient, but you got him in the right room,
Mm-hmm.
and in the right bed. Because in the rooms, you have what?
Two beds.
Bed A
Bed
and bed
B.
B. And you gotta look, bed A is by the door,
Might be by the window.
and bed B by the window.
I get
Some facilities don't use bed A and bed B.
No.
You just have window
and door.
and door. They don't use A and B. So if you come across a facility A and B, find where it's A. If
Yep.
they want A to be the window, or they want A to be the
Door.
Door.
Mm-hmm.
Right, so those are all just common ways of identifying your patient and know who you're working with. Just,
No, I was gonna say sometimes too, have the patients restate their name when you read it. If the patient, is alert, you have them say their name also.
yeah, so this is one of the things we talked about yesterday, that even if the patient can't talk, you get what? Members of the staff who work with the patient can also identify the patient. Okay?
Also, I know sometimes it happened before where you go into the room and you say, "Hey, I'm looking for Joe," and then the person that's not just say, "Hey, yeah, that's me."
Yeah,
So you gotta be very careful. Sometimes that could happen. Right. Yeah, that could
And then
happen
you have
too.
situations whereby you have two patients in the room.
Same first name.
Same first name. Oh, same last name.
So these patients have we call name alerts. Okay? So you gotta look out for name alerts because you have patients who actually have the same name. Actually have the same name. I doubt they'd be so crazy to put both of them in the same room.
Sometimes they do.
All right. Now, when you look at the drugs that is on the MAR now, look at the drugs on the MAR. Look is what there. First thing you're gonna have what? The medication name,
Medication
right?
name.
Right?
Yes.
Yes.
Yeah.
Medication name. And then what next is gonna be after that?
The route.
The
The
dosage.
route.
Required dosage,
Right. Dose
right?
and the route,
And frequency.
frequency. Yeah.
So
Time.
in
The
your,
time.
the order, as it's on there,
Yeah,
you're gonna have the
see.
medication, dosage, and the route,
Frequency.
And frequency.
right? 25 milligrams, BID, via,
PO.
right? So we know that's
Orally.
right. And when we get now the what we call the blister pack, you take the blister pack and you what? Compare it to your
More.
More.
MAR and ensure that they both.
All the same.
Correspond.
Anything else will be on that area?
Mm-hmm. That's it.
Time.
The frequency also sometimes you will have the time, like what Pharrell
So we have
said.
what?
When they say frequency, they can also indicate what time. It's like it could be every.
Right.
Yeah, they could write it down too.
You can have that put down there, you know, because usually with the frequency you have, we did it yesterday, what we did? We did OD, what else?
HS,
BID.
HS,
HS,
BID,
BID.
BID,
TID,
CID,
TID,
QRH,
QID,
all right, QID.
QF4H, Q6H, QH8, 8H, I'm sorry, QH8. And what was the other one? You said stat. We did stat. Mm-hmm. PRN.
PC, afternoon,
Oh, you said yeah. PC and AC. Mm-hmm.
Yeah, I was in class yesterday.
Yeah.
I'm proud of myself.
QWK.
Start immediately.
Which one is that?
You just send that.
CIW?
Where was the CIW?
Is that TIW?
Every week, 3 times a week.
TIW, BIW. Bi-weekly?
Yeah, and as necessary.
What's the last two?
Is
How do you write
You don't have all of them.
patient is to receive the medication
PC is afternoon.
3 times a week?
PC
TIW. TIW.
American, twice a week.
Okay. That's hard. How do you do that?
It's right
See
there.
it right there.
CIW.
Oh, B,
Anyway,
3 times, 2 times.
These are, some people get medication, even
They are
monthly.
in a meeting.
They can even put 230 days.
Yeah.
Mm-hmm.
And especially like that medication, what medication did we talk about that a patient can have every 2 weeks or every month? What medication we spoke about recently?
Yeah, the vitamin
The
D. That
Novanax?
Yeah.
B12,
also,
where we were talking about their
Yes,
patients who
one.
have, can possibly get pernicious anemia,
Yes.
right?
B12.
D2. Is it that
B12, yeah.
So,
everything.
all I remember this is just the frequency. The dosage just said we spoke about when you give it in liquids
Mm-hmm.
and when you give it in what? The solids, right?
Soap sud.
You talk about
Solid.
That's good.
cc's,
Mm-hmm.
milliliters, ounces, liters.
Mm-hmm.
We spoke about milligrams, micrograms, units,
Teaspoon,
right? We did the
ounce,
teaspoon, 5 mLs, 2
Tablespoon.
15 mLs, for tablespoon,
milliequivalent.
and 30 mLs is equal to an ounce. And we know a cup is what, 240 cc's, which is what, 8 ounces?
Mm-hmm.
Oh, that's only cute.
Ointment, suppository, tablet, solution,
As most times for the CNAs,
drops.
they will be feeding the patient and they have to do what? I&O, right? And you must know how much a cup contains.
Yes.
And a cup contains how much?
30
240
cc's.
cc's, which is 8
8
ounces.
ounces.
So the CNA is going to tell you, oh, they drink about half the cup. So what they tell you to drink half the cup? When you take it, you know it's
120.
going to be 120
20
cc's.
cc's.
All right?
Mm-hmm.
But that's what you, before you don't got to bother the CNA about ounces and how much you think the ounces a take or how much milliliters. They did your half the cup, quarter cup, 3/4 cup, full cup. It's now up to the dietitian to work it out. Because the dietitian will be doing what? When she asks for these information, what is she doing?
She wants to know the
Now the dietitian asks for these information for the I know, what is she's doing? She what?
counting the calories.
She's counting the calories. And why she need to count the calories?
Maybe the patient
If they're getting enough
maybe
calories.
To see the patient to get enough calories. Remember we did the calories the other day? We talked with patients need calories, why? So they can get energy, so they don't become fatigued. Okay? But most of all, when she's doing this, for the BMI, right? Body mass index, she's doing, you know, how much calories a patient will need. But she's usually asking for doing over what period of time? If she want to look at this patient who's losing weight. Every patient in a nursing home or subacute facilities every month. What she look for?
Wait.
72-hour check, food check, the calorie count. Remember you guys did calories? Calorie count you do every 72 hours to that patient. I mean a 72-hour calorie count. And then after that 72 hour, she come up. I remember I asked you guys to do 1 day for yourselves. She do a 3-day calorie count to come up. Your assignment was to do calorie count on yourselves for 1 day. And then ask you to do 3 days. But this is why all that comes into what we're doing. Everything comes together, piece by piece. So when you get assignments, please try to complete it. Okay. when you go through all the different lists, you're gonna find that with the medications, you have different type of medications, right? Different dosage, different frequency, different routes. Would you find on the MAR patient receiving ointment for a rash to the right knee?
No.
BID.
No.
Hmm?
No.
You're not gonna fight in the MAR?
No.
Oh,
Rash the right knee,
Not
apply.
gonna find
No.
you have to put everything in.
Will it be in your medication administration record?
No.
No.
it. Being,
It is not gonna be on your medication administration record. It's gonna be on
Treatments.
your
thought.
card.
Treatments.
Treatment card.
What about putting eye drops in the nose? Is that what you heard?
Medication.
That's medication, right?
Boys, you guys not listening to me. You don't put eye drops in the nose.
In the nose.
Wake up.
Oh, we sleeping.
Wake up.
It's nasal.
Just wake up, guys, wake up. So now, do you put eye drops on the MAR?
No.
Yes.
No. That's a
You
treatment.
put ear drops.
Ear? Yeah.
Yes.
That's all treatments,
Medication.
right?
Medication.
Okay.
Do you put nose drops?
No.
Yes. Yes. They all go in the
All those will go
In
on
the tar.
Mar.
The mar. Okay. The mar.
Okay?
Okay.
All those will go on the MAR. The eye drops, the nose drops, and the ear
Ear drop.
Okay.
But when you come to
ENT.
skin applications,
Go to
what
the
have
MAR.
you, where you have ointments and rubs, you're not going to be putting it on the MAR.
It's gonna be in the car.
Not a find it on the MAR. Not sorry, not you putting it, but the pharmacy. Card. Card.
Car.
PO medications, about the only medications that you're gonna find that really be in the tar, on the MAR, are related to going via the skin, is your transdermal patches. The fentanyl patch, will be in your mouth. Go by the skin, right?
Mm-hmm. The fentanyl patch goes in the mar?
Yeah,
it's
'cause
a
the medication.
Okay. I'm trying to clarify so I can
So
learn.
most,
Okay.
now we usually will use, and I want you to look at this. Normally you have RX, right?
Mm-hmm.
Yes.
Treatment order.
Now, this and that, for your own edification,
Edification.
look at the word treatment. Look to the word treatment. So if you talk about treatment records,
Only treatment.
this is what the word treatment. What does the treatment mean?
What does a treatment mean?
Can reach someone with deal with someone with directive required a full treatment for mental
under for medical care device for a patient or an illness or anything. That's the medical.
So the, see, treatment is not, as you see, treatment administration record. It's not just saying that it's something you rub on the body and there's treatments alone. But medical treatment is also encompass all the stuff that you will be getting. You guys agree?
Yep.
That's why I try to make it very clear for you that what's on mark and what's on card. So you know the difference. But please understand the word treatment. I'm going to the doctor because I need what?
Treatment.
Treatment. The doctor's going to treat me for my heart problem. I go get treatment for my eyes. I have a skin rash. I gotta get treatment, right?
Yes.
But when it comes to putting it down on documentation, you put them in different places. And so you have to know where to put that. What goes in the treatment administration record versus what goes on your,
Medication administration record.
they're all what?
Treatment.
All right, take a minute and review what we talked about this month.
What goes in the medication administration record and what goes in the treatment administration record?